Hello.
हाँ जी, Dr. Bansal.
Can you hear me now?
Yes, yes. Yeah.
Yes.
Okay, I'll get it started.
Yeah.
Yes. Good afternoon, everyone. I am Mehreen, member of the Human Rights Council, WICCI Chandigarh, and your host for the session. I welcome you all to this webinar, which has been scheduled to be conducted on World Heart Day, September 29, which is today, of course. World Heart Day is annually observed with an intention to increase public awareness of cardiovascular diseases, including their prevention and their global impact. Cardiovascular diseases remain the world's #1 killer, resulting in 18.6 million deaths a year. What are the causes of this disease? What changes are to be made in our lifestyle in order to prevent these diseases? Are these diseases curable? If someone has undergone a surgery in the same regard, will he be able to have a normal life again? Or is he still under the threat of it taking a toll on him all over again? I'm sure these are a few questions in your mind as well. And I want all you attendees to know that we're lucky enough to get all our questions answered today from an exceptionally talented, skilled, and empathetic and a leading cardiac surgeon, a surgeon who is well known for his professional courtesy. I am honored and delighted to welcome Dr. Ashwani Bansal, Chief Cardiac Surgeon, Minimally Invasive Adult and Pediatrics Heart Surgeon at Indus International Hospital, Mohali, Punjab. Dr. Ashwani Bansal has received extensive 14 years of training at India's best medical institute, AIIMS, Delhi. Dr. Bansal was part of heart transplant and heart failure surgery team during his training at AIIMS, Delhi. Dr. Bansal has further received training in minimally invasive bypass heart surgery from Poland. Dr. Bansal is expert in both adult and pediatric surgery operations. Thank you so much for sparing the time for us, despite of having so much on the plate and yet being considerate about accepting our invitation. We are absolutely pleased to have you with us. I also extend my heartfelt welcome to Mrs. Deepika Bahri, UT Chandigarh, WICCI, Women's Indian Chamber of Commerce and Industry, along with the presidents, vice presidents, and council members of other wings as well. I would like to welcome all the attendees once again. This sure is going to be a wonderful session, hence stay tuned. But also please turn off your microphones. Now I invite Mrs. Deepika Bahri to welcome our esteemed key speaker, Dr. Bansal. Over to you, ma'am.
Dr. Bansal, we are very grateful to you for sparing your precious time for this webinar. But yes, the audience of 30 members is waiting desperately for their questions to be answered. So I won't take much of your time and the audience's time, and let's get started, Mehreen, with it.
Yes. The attendees are requested to please turn off their microphones. If it's in your control, ma'am, kindly do it.
Yes, my team is handling it. Yeah.
Sure, ma'am. Thank you. Also, I want all the attendees to know that this is going to be a question and answer format. In the first half, I'll be taking up questions on everyone's behalf. And in the second half, you too will get a chance to ask questions. Hence, cooperation is needed from your side. While Dr. Bansal is speaking, no interruptions should be initiated from your side. This webinar is going to be of 1 hour duration because you all will agree to the fact that even a minute is precious for Dr. Bansal, since he is still kind enough to give us an opportunity to have a session with him. Before starting off, I would like to ask you if you want to say something, sir.
Yeah, I welcome you all for the webinar and grateful that you have invited me for this webinar. And in today's scenario, when not heart disease is not just for our, we are hearing so many celebrities that people are having heart attacks at very young age. So,
Yes.
so we will discuss what are the causes for that and that. So young patient below 3 years is very productive. It's a productive society member. So we want them to stay healthy and do good work for the society.
Fine, sir. So let's get it started. So, Dr. Bansal, what are cardiovascular diseases? What are its causes?
Uh, very good question. Cardiovascular disease is a huge spectrum actually. So we are talking about the diseases in the this seminar we will be fixing ourselves to causes blockages of the heart. So, because of lifestyle changes, diabetes, hypertension, and the living lipid profile, there is a lot of blockages that occur inside the body in various parts of the organ. So, like in the heart, if the blockage is there, it will lead to heart attack. The blockages can occur in the brain, in arteries also.
The attendees are requested to kindly turn off their mics. The attendees are requested to kindly turn off their microphones, please. We cannot afford our time to go this waste. Thank you. You may speak, sir. Really sorry for the interruption.
Hello.
Hanji, doctor.
We can proceed with the question.
Yeah.
I'm really sorry for the interruption, sir. Do men and women experience the same symptoms regarding heart diseases?
No. Once, hello, can you hear me now?
Yes, sir, you're audible, sir.
So, your question was, do the men and women?
Yes, sir.
Hello.
Yes, sir, you're audible, sir.
So, yeah, in males with the heart disease or heart attack, they have symptoms like chest pain, difficulty in breathing. In females, the symptoms of heart, they have symptoms like epigastric pain, nausea, feeling, and vomiting sensations. So it is compared to males, it is difficult to detect heart attacks in females. So we need to have high index of suspicion in females coming with the vague symptoms of epigastric pain and nausea. Then even then we have to suspect that she might be having heart attack. We have to see the ECG and do an echo for her and diagnose whether she's having heart attack or not.
Okay, fine, sir. Does younger, physically fit generation need to worry about heart diseases at all?
Actually, as we started with this session, that even the younger generation is now having heart attacks. So there is a specific reason for that, because heart diseases run in families. So if a family is having a heart disease, let's say 50 years of age, So there is a tendency that the next generation would tend to have the disease at 40 years of age.
Okay.
So that is the familial genetic contribution to that. And then the lifestyle contribution is like smoking tendency has increased in last 10 years, and work related pressure, and younger generation are finding it difficult to balance their life between work and their family time. So all these things increases the tension, and that increases the cardiovascular risk.
Okay, I think you answered another question that I was going to ask. How does a family history affect heart health?
Yes,
So,
yes.
what is the link between smoking and heart disease?
Smoking has, if we say somebody that they want to cut down on they want to cut down one risk factor, so smoking is the one thing which contribute maximum for the cardiovascular diseases. So if a person is smoking, it increases 10 times the chances of heart attacks. So if whenever we are doing bypass heart operations, or if for the sake valve operations, we tell our patients not to do smoking at all. We help them in quitting smoking by prescribing them medicines so that their craving for smoking is less.
Okay, so there is this confusion in a lot of people. I don't know how far the statement is true, that when they are being asked that you should quit smoking, they say you can't quit it at once. You'll have to do it gradually. How far is this statement true? Can it be cut down at all at once, or it actually has to go for that gradual process?
And there are both the scenarios are correct actually. It depends on the will of the patient. And so one of my very close friend is a senior expert in de-addiction center at AIIMS. So we often discuss how do you make your patients who are smoking for last 20 years, how do you make them quit smoking. So, if a patient is motivated that he want to quit the smoking and he understands the health benefits, then he can quit it at once, and we can give them medicines so that he doesn't have craving for that. So that is one way of quitting smoking. Another way is people do it gradually also, but over the
Okay.
maybe 1 month time is a good time to quit smoking. Both the
But
both the
is
ways
it going
are correct.
but is it going to affect the heart anyway if they're going to cut it down at once?
No, importance is to quit the smoking, because if they are taking it for last 20 years, even if they are stopping it in next 1 month, I think that is acceptable.
Fine, sir. What dietary changes can one make to reduce heart disease risk?
The most important thing is fat and carbohydrates. People think that they are not taking sweets, so they are taking a healthy diet. Healthy diet doesn't mean that you should only avoid sweet products. Carbohydrates also contribute to a lot of plaque material that deposit inside the heart. So there should be balance between protein, carbohydrate, and some amount of fat. And but our Indian diets are rich in carbohydrates. Everybody eats protein, chawal. So we need to have mix of salad, mix of protein in the form of egg, in the form of soya bean, paneer, so that we have a balanced diet of both protein and carbohydrate. Hello.
Yes, Mehreen.
Yeah. Can you hear me?
Yes, sir. I think Mehreen के end से issue आ रहा है.
Okay, ma'am.
Yeah.
We can continue with the rest of the questions.
Right. Sir, I'll take up the next question until she joins back. So, sir, how do I check my cholesterol level, and does it have anything to do with my heart?
Yes, cholesterol level can be easily checked by any of your nearby labs. Complete lipid profile should be checked at least once in a year for people who are above 40 years of age. And if the lipid profile is abnormal, then we advise the dietary changes and some medications. And after these changes are made, then after 3 months, lipid should be rechecked.
Okay. So means routine checkup is very important in this case.
Yes. Yearly above 40 years of age.
Okay, sir. Sir, are these heart problems linked to high blood pressure also?
Yes. What does the high blood pressure do is it increases the stress inside the arteries. That arteries can be of heart, can be of brain, can be of kidneys. So high blood pressure affects all the organs. So
Okay.
in heart it increases the chances of heart attack. In kidney it decreases their function, and in brain it increases the chances of paralysis. So it is very important to have regular blood pressure checkup, and the pressure, systolic blood pressure, the pressure which is mentioned first, should not cross 140.
Okay. Okay. So the next question that comes to my mind.
Yeah, next question. Can you please repeat
Sir,
the question?
is stress related to heart disease?
Yes, as we discussed that in the younger age group now, the heart attacks are increasing mainly because of the stress. As the competition is increasing, people are facing a lot of professional challenges, work-related stress, and difficulty in balancing between work life and family life. All these stresses, along with family history and smoking, increases the heart disease.
ओके एंड जैसा कि और वैसे भी सर कोविड में इफ आई रिलेट टू इट आपका क्या ऑब्जर्वेशन रहा है कोविड में द स्ट्रेस हैज इंक्रीज्ड एंड सो हैज द हार्ट डिजीजेस
Yes, in the last 1.5 year, we have got a lot of younger age group patients who have reported to us with stress-related things. Sometimes stress mimics as heart problems. So we have tested them, and we have found some of them had severe heart disease also, but most of them were anxiety-related problems.
ओके राइट सर सो सर वंस आई अंडरगो समथिंग रिलेटेड टू हार्ट मेरे को हार्ट अटैक होता है या मेरी सर्जरी होती है so how soon I can get back to a normal routine? Will I ever be able to live a normal life after that?
Definitely. So there are two techniques by which heart surgeries are done these days. One is open heart surgery, and one is minimal invasive heart surgery. In minimally invasive heart surgery, we don't cut any bone. Through the rib space, we can perform the heart surgery. So the patient can go back to work within 15 days. So the younger patients, and it is very helpful that they can return back to the work. There is no limitation for lifting weight, and the scar is also less. Even with the conventional surgery, within 2 months, people can join back their work, and they can have normal life.
Okay, but there are always restrictions on eating habits, I suppose, sir?
Yes, we will always after heart surgery, there would be healthy diet restrictions, and immediately after surgery, there would be a diet chart that is given to all patients. They have to follow that chart for at least next 15 days.
Okay. So just on the lighter note, should I ask that should we first wait for the heart surgery and then adopt a healthy lifestyle, or should we adopt it beforehand only?
Definitely, you should adopt it beforehand so that you don't have to see me.
Oh, very true, very true. So, anything else that is coming to the audience mind, I would love to ask them in the comment section also. Otherwise, we will take up the question answers after I finish up with everything. तो मेरे तो सर इतने ज्यादा क्वेश्चंस आते जा रहे हैं माइंड में. What are the symptoms of a heart attack?
Yeah. For the males, the symptoms are like chest pain, having breathing difficulty, heaviness in chest, For
Ji.
females, the symptoms are little vague, in which the epigastric pain, nausea, vomiting, and sometimes chest pain is manifested in heart problems.
Yeah, you have already discussed that कि आपको
Yeah.
females में या symptoms are lesser and males में. And sir, is there any ratio? क्या female ज्यादा होती है heart patients, male ज्यादा होते हैं? कुछ इसमें रहता है कोई observation या statistics?
60% males, 40% females.
Okay, okay.
Hmm.
And sir, you are also a pediatric surgeon, heart surgeon. So these children have it by birth, I suppose, because I have seen you operating 2 months, 3 months, and even a few days old child.
Yes, yes. Yes, all these pediatric heart problems are 99% acquired during birth only. And sometimes there is a hole in the heart. Sometimes the blood, the vessel which is carrying blood to the lungs is not properly made. So depending upon the disease, child have different kind of symptoms. Some will have symptoms like they are not gaining weight, they are having recurrent infection of the chest, and some another spectrum will have symptoms like the child is blue whenever child cries, the lips are blue, fingers are blue. So we have different protocols of treatment, different surgeries for each kind of surgical problem.
Right, sir. So, sir, in the comment section, we have a question from Dipali. And Dipali says, my in-laws have a history of high blood pressure. What precautions should we take for my husband so that he may have a healthy heart?
For hypertension, what she can do for her husband is first of all she should restrict to be added to the dishes that they make at home. And the second important thing is weight control. The weight should be there should not be excessive weight. So there is a simple formula for ideal weight. Whatever your height is there in centimeters, suppose somebody height is 160 centimeter, so you reduce 100 out of that, so 60 kg is your ideal weight. So you should target for the, so height in centimeter minus 100 is your ideal weight.
Okay, so that's, I think I never discovered, this is what I'm discovering today. So audience के लिए भी बहुत अच्छी insight है. Whatever is your height in centimeters, उसमें से 100 निकालिए, so that should be your ideal weight. So I hope, Dipali, you have your question answered. Otherwise, you can unmute yourself and ask. So Mehreen is back with us. Mehreen, some
Yes,
network
ma'am.
issue?
Yes, ma'am. These technologies, you know. I'm
Yes.
so sorry for the inconvenience.
No issue, Mehreen.
Can I carry on, ma'am?
Yes, please.
Fine, ma'am. Okay, sir. So, what is the actual meaning of minor heart attacks? Is it something to be taken lightly, or is it an alarm or a sign?
Minor heart attack term is mostly used when the patient is having some branch. So I'll show you one diagram. See, this is
Sure.
a heart model in which this is the major artery which is supplying the heart. I hope people can see that. So
Yes,
if
sir.
there are some smaller branches which are coming from this major vessel, so if there is a minor heart attack, these smaller branches mostly have clots, which lead to smaller part of heart, which is causing the pain and ECG changes. So if the major branch or its origin is blocked, then the attack is major and the major portion of the heart will be involved if the major branch is involved. So this is the difference between minor heart attack and major heart attack. But when the patient is having minor heart attack, that means the disease would be there in the major arteries also. So the treatment has to be started and precautions has to be taken.
Taken. Fine, sir. Got it. So people who have had heart surgeries can live a normal life again and not need to worry anymore. Is it true, or they have to be under a threat?
We already discussed with that with Deepika madam, and
Okay, fine, sir. So how bad is the stress affecting our heart?
Marine, we have
Yes,
already taken the questions. So now you
Okay,
can
ma'am.
take in the chat bot and then ask the audience if they have any questions.
Fine, ma'am. The attendees can now drop in their questions, if any.
Marine, we have a question in the chat bot if you can check. Seema Gupta ji has written. Okay,
They
she's
have-
wishing, yeah,
yes,
she's wishing great
She's just
health.
wishing, yes, ma'am.
Okay.
Good evening, Deepika ji.
Ji Seema ji.
Can I ask? Good evening, Dr. Saab.
Yeah, good evening, Seema ji. कैसे हैं आप?
I'm good, ji. Thank you so much. Just one query.
हाँ जी, पूछिए.
Dr. Bansal, just one query. जैसे हम ट्रेडमिल पे अगर रन कर रहे हैं या बहुत तेज चल रहे हैं और वहां पे डिजिटली फ्लैश करती है 165, 170 के अराउंड, तो हमें कैसे पता चलता है भी हमारी हार्ट बीट एक्चुअली में ये ठीक शो कर रहा है और इसका कितना मतलब कितनी रेलिवेंसी है? माय कंसर्न इज दिस ओनली. Am I audible?
Yes, ma'am, you are.
मैडम, आजकल बहुत अलग अलग तरह के ट्रेडमिल्स आते हैं. कुछ ट्रेडमिल्स बहुत ही सेंसिटिव हैं जो कि हार्ट रेट के साथ सैचुरेशन भी बताते हैं. कैन यू हियर मी?
Yes, yes.
Hello. Yeah.
Yes, sir, you're audible.
Yes. So there are various kind of treadmills which are available these days. So किसी में तो हार्ट रेट एंड सैचुरेशन भी अच्छा एकदम सेंसिटिव बताते हैं. So अगर आप हार्ट रेट अपना 160 170 तक अचीव कर पा रहे हैं, so it is a good sign that you are giving stress to your heart and you are able to you are not still not tiring and you can continue with your exercise. So once 180 तक हार्ट रेट एक्सेप्टेबल है. 180 तक आप हार्ट रेट अचीव करके उतने पे आप अपनी एक्सरसाइज कंटिन्यू कर सकते हैं. तो एथलीट्स के साथ में जो रेगुलर एक्सरसाइज करते हैं उनकी हार्ट रेट धीरे धीरे कम आ जाती है एक्सरसाइज करने के साथ साथ.
तो इसका एज ग्रुप का कैसे हम उसको कोऑर्डिनेट करें? आई मीन रेशियो क्या होगी? लाइक 50 अगर फीमेल मेंबर 50 इयर्स का है एंड उसका हार्ट बीट वहां पे 170 शोर हो रहा है, सो व्हाट इज द क्राइटेरिया? आई मीन
मैडम, इसका एक चार्ट होता है. एक चार्ट होता है जिसको एज के साथ और वेट के साथ हम आइडियल टारगेट हार्ट रेट अचीव करते हैं. जब हम टीएमटी करते हैं, ट्रेडमिल टेस्ट करते हैं, तो उस चार्ट को हम लगाते हैं कि पेशेंट का वेट इतना है, हाइट इतना है, तो उसके साथ उसका आइडियल टारगेट हार्ट रेट कितना होना चाहिए. सो वो मुझे नहीं लगता कोई भी, बहुत सारी जिम्स में मैं भी गया हूँ तो वहां पर वो उतना किसी भी मेंबर को बताते हैं कि आपका हार्ट रेट इतना होना चाहिए. बट रफ गाइड ये होता है कि अगर हाँ, जब भी कोई हमारे जिम में जाते हैं, वो जितना वो चल सकते हैं कंफर्टेबली बिना सांस फूले हुए, बहुत ज्यादा सांस फूले हुए, उतना एक्सरसाइज करते हैं. बट इफ समबडी वांट्स टू नो कि व्हाट इज देयर टारगेट हार्ट रेट जो उन्होंने जिम में अचीव करना है, दे कैन इजीली गेट इट ऑन द नेट कि आपका टारगेट हार्ट ऑन आफ्टर एक्सरसाइज वेट और हाइट के हिसाब से कितना होना चाहिए.
राइट. थैंक यू सो मच डॉक्टर बंसल. थैंक यू.
Can I ask a question?
Yes, please.
Yes, ma'am.
हाँ, गुड इवनिंग डॉक्टर बंसल. सर मेरा क्वेश्चन था कि कोलेस्ट्रॉल जैसे हम चेक कराते हैं, लिपिड प्रोफाइल जब होता है, तो उसमें क्या देखना है हमें कि क्या चीज ऊपर नीचे, जैसे HDL, LDL, VLDL, ट्रिग्लिसराइड्स, तो कौन सी चीज ज्यादा वरी करने के लिए हमें उसका ध्यान रखना चाहिए और क्या क्या लाइफस्टाइल चेंजेस लाने चाहिए?
उसमें सभी चीजें इंपॉर्टेंट है. जो लिपिड प्रोफाइल में टोटल कोलेस्ट्रॉल, LDL, HDL, ट्राइग्लिसराइड, एवरीथिंग हैज देयर ओन इंपॉर्टेंस. तो हम उसको लिपिड्स को 2 पार्ट में डिवाइड कर लेते हैं कि व्हाट आर गुड कोलेस्ट्रॉल्स एंड व्हाट आर बैड कोलेस्ट्रॉल्स. सो गुड कोलेस्ट्रॉल में आपका HDL आता है जिसकी वैल्यू ज्यादा होनी चाहिए, और बैड कोलेस्ट्रॉल में ट्राइग्लिसराइड्स एंड टोटल कोलेस्ट्रॉल की वैल्यू होती है जिसकी वैल्यू कम होनी चाहिए। तो जब भी जब भी आप टेस्ट कराते हैं तो लैब की वैल्यू 200 से कम होनी चाहिए, HDL की वैल्यू 40-50 से ज्यादा होनी चाहिए, LDL की वैल्यू 100 से कम होनी चाहिए। तो सभी लैब्स अपनी रेफरेंस वैल्यूज साइड में देती हैं, तो उस रेफरेंस वैल्यूज के अकॉर्डिंग आपका लिपिड प्रोफाइल रहना चाहिए। अगर उसकी वैल्यू ज्यादा है, वो हेल्दी डाइट्स के बारे में बताएंगे जो हमने ऑलरेडी डिस्कस किया है। अगर किसी की बहुत ज्यादा रेंज में आती है, फैमिली हिस्ट्री भी है, तो हम उनको मेडिसिन भी शुरू करते हैं लिपिड के मैनेजमेंट के लिए।
तो कहाँ तक उनका रेंज, मतलब ट्रिग्लिसराइड ज्यादा कितने तक होने चाहिए कि मेडिकेशन पे जाना है, कितने लेवल तक हम डाइट से मेंटेन कर सकते हैं या लाइफस्टाइल से?
एक बार अगर फर्स्ट रीडिंग अब नॉर्मल आती है तो हम 3 महीने का ट्रायल देते हैं पेशेंट को, 3 महीने का डाइट वेट रिडक्शन का ट्रायल देते हैं। अगर वो 3 महीने के ट्रायल के बाद में भी उसका रिपीट लिपिड्स भी अब नॉर्मल आते हैं, तो फिर हम उनको डाइट शुरू करते हैं। जहां तक रेंज की बात है, टोटल कोलेस्ट्रॉल अगर 200 से ज्यादा आ रहा है, LDL वैल्यू अगर 100 से ज्यादा आ रही है, HDL की वैल्यू 30 से कम आ रही है, तो हम उनका ट्रीटमेंट शुरू करते हैं।
थैंक यू डॉक्टर।
थैंक यू।
Do we have another question? Okay, doctor, I want to ask, since it's the hot topic nowadays, heart attacks, like we talked about it earlier as well. Is there something, a medicine or anything that one can give to that patient who is actually having a heart attack, like at the moment, if he's suffering a pain or, you know, the causes is known to him? Is there anything that we can do until we reach the hospital, something that can be done temporarily so as to save the life of that person?
Yes, yes. Definitely. There are, if the person is known to have heart disease or somebody is having these life-saving medications nearby, then ecosprin of 300 mg should be given, and sorbitrate tablet sublingual, which can be just placed under the tongue, 5 mg tablet can be given, and it will definitely improves the chances of increasing blood supply to the heart. And whenever the patient reaches to the hospital, there are better chances for survival after the heart attack. So ecosprin 300 mg and sorbitrate 5 mg. And the patient who is having heart attack should be calmed down, because with the anxiety, if the people around them are anxious कि heart attack हो गया, the patient will get anxious and his heart rate will increase, and then the further demand of blood will be high for the heart. So so patient should be calmed down and should be immediately taken to the nearby facility.
Thank you, sir. Got it. Yes, somebody? Any questions? This is a one-time moment, everyone. You're not going to get this chance again. How does the vitamin D deficiency affect our heart? This is the question, sir.
Yeah. Vitamin D deficiency generally has overall effect on body. It has main effect on calcium metabolism. So it decreases the calcium inside the bones. So the osteoporosis chances increases. So it increases the chances that the patient will not be doing exercises and the mobility will be less. So these patients are generally obese. And they are generally, because they are obese, they are not able to walk around. It indirectly increases the heart problems. Otherwise, vitamin D directly doesn't causes heart problems.
I hope your question is answered.
Yes, I got it.
One more question, Dr. Bansal, if the time permits.
Yes, yes, please.
See, I'm just sharing, my query. It's not a problem. I am 51 plus, right? And I do brisk walking and a little bit of yoga and sometimes, jogging. So I sweat a lot, but restlessness or, any kind of trouble I never feel. So should I go ahead with this type of nature or performance or my workout, or I should do before consulting? I mean, I should consult someone because of my age barrier. Just give us some suggestion, please.
Yeah, I understand your concern. That 51-year age is not that you should be worried about, and what you should target, the formula I told you about the ideal weight, you should try to target to achieve that weight. So to achieve, you should have both the approaches. You should have at least half an hour of brisk walking, and at the same time you should have carbohydrate, low fat diet also, and
Okay.
try to keep the meal at the time of the night should be the lightest, because during the night time there is more of deposition of glycogen inside the liver, and there is more chances of lipid deposition inside the arteries. So the
Okay.
night time diet should be lightest, and low carbohydrate, low fat diet, and half an hour of brisk walking. If you do all those things, gradually you will have less of problems while walking or doing your exercise.
Perfect. One more. How about this oil pulling? I heard so much about it, but I was just curious whether I should opt for it or not. So, what are the plus points, if may I ask?
We are talking about, question is about
Oil pulling procedure. I mean, is this very beneficial for the health?
okay.
Virgin coconut
Uh-huh.
oil pulling.
You're talking about mixing various kind of oils in
Sir,
the
yes,
diet.
sir.
No.
What she means is, I सीमा जी, आप कुकिंग ऑयल के बारे में बात कर रही हैं?
No, virgin coconut oil edible for oil pulling, जो usually guide कर रहे हैं आजकल योगा practitioner भी, आप उसको 1 spoon या 2 spoon मुंह में डाल के उसको rinse करें with full force and spit it out in the early morning. So I never did that before starting it. I just want to, this is just a personal question.
Something which I'm not expert of.
Yeah.
Thank you so much.
सीमा जी, साइंस तो इन चीजों को कभी परमिट नहीं करेगी.
जी, thank you so much. Thank you. Right.
So I have a question. Is laughter really
Yes.
your best medicine? So you're not audible.
Not audible. Yeah.
Yes.
Hello.
हाँ जी, अब ठीक है Bansal.
So, like we discussed, that stress is causing so many heart attacks even in younger age group. Because I think they have less time to go with friends and have once they are into their professional life, they are into their professional life. So they must have some time to go with their friends and have some time off from their busy schedule. So that is all that means by this quote, I think.
Okay, so
I have one question. What kind of oils to be used? जो सीमा जी पूछ रहे थे वो चलो डिफरेंट क्वेश्चन था कि हमें अपने किचन में, इंडियन किचन में कौन से ऑयल्स के रिगार्डिंग प्रिकॉशंस लेनी चाहिए और कौन से हैं जो आगे यूज करने चाहिए. सरसों का तेल और ये जो हम सुनते हैं हमारे पुराने जो
सिंपल नहीं, इसमें जो आजकल जो लेटेस्ट कॉन्सेप्ट है इसके ऑयल्स के लिए, we use we recommend कि vegetable oils use करें, but उसको rotate करके use करें. ऐसे नहीं कि हम एक ही तरह का oil जो है, क्योंकि हर एक oil में different kind of useful fatty acids होते हैं, unsaturated fatty acids होते हैं. So we want, but कोई भी oil complete नहीं है कि एक तरह के oil के अंदर आपको एक variety के fatty acids मिलते हैं, दूसरे में दूसरे तरह के मिलते हैं. So इसीलिए आप आजकल देखेंगे कि जो कंपनीज ऐड करते हैं वो मिक्स वेजिटेबल ऑयल्स को ऐड करते हैं. उन्होंने 2 या 3 वैरायटी के वेजिटेबल ऑयल्स को मिक्स करके ऑयल बनाया, सो दैट दे कैन कंबाइन कर सकें. सो फिर भी हमें आइडियल कॉम्बिनेशन नहीं मिलता है, तो इसलिए हमने एक बार एक तरह के वेजिटेबल ऑयल यूज किया, दूसरे टाइम हमने सपोज ऑलिव ऑयल यूज किया, तीसरे टाइम हमने राइस ब्रान ऑयल यूज किया. तो इस तरह से हमें रोटेट करते रहना चाहिए. मे बी आप एक साइकिल फिक्स कर सकते हैं 4 मंथली साइकिल, तो साल में आपने 3 तरह के ऑयल्स यूज कर लिए.
Okay, and whether mustard oil is good for our heart?
मस्टर्ड ऑयल इज, जो लोग बताते थे एंशिएंट टाइम्स में कि हाँ यूज करना चाहिए, बट उसके अंदर जो फैटी एसिड्स का कंटेंट है वो मुझे भी चेक करना पड़ेगा कि वो एक्चुअली क्या यूज करना चाहिए क्या नहीं करना चाहिए. बट हम यूजुअली जो मेरे पेशेंट्स होते हैं उनको मैं मस्टर्ड ऑयल के लिए रेकमेंड नहीं करता हूँ. मैं उनको वेजिटेबल ऑयल्स के लिए रेकमेंड करता हूँ, और वो भी मिक्स करके, फैटी एसिड्स को मिक्स करके रेकमेंड करता हूँ.
Thank you.
सर, तो आपके अकॉर्डिंगली कौन कौन से ऑयल्स यूज करने चाहिए फिर? क्योंकि डाइटिशियंस तो देसी घी भी कहती हैं बहुत यूज करो, मस्टर्ड ऑयल करो, ऑलिव ऑयल करो, बस और किचन में से सब कुछ निकाल दो. दैट इज व्हाट दे से.
ऑलिव ऑयल इज गुड, वेजिटेबल ऑयल इज गुड, राइस ब्रान को आप मिक्स कर सकते हैं बाकी वेजिटेबल ऑयल के साथ. सो दे आर गुड ऑयल्स.
हाउ अबाउट घी?
बेसिक घी के अंदर सैचुरेटेड फैटी एसिड ज्यादा होते हैं जो कि हार्ट डिजीज के चांसेस को बढ़ाते हैं. तो वो आप देसी घी को अगर यूज करें तो बहुत लिमिटेड अमाउंट में यूज करना है. आप अपनी जनरल कुकिंग के अंदर जो आप ऑयल यूज करते हैं उसकी जगह घी को यूज नहीं करना है.
ओके.
We still have a few minutes left, everyone. Okay, we have a question. What are the symptoms of clogged arteries? What can we do to unclog the arteries?
Yeah, so the symptom is this is a very generalized question. I would say that clogged arteries can be of any organ. Suppose the arteries are clogged for the heart, you get heart attacks. If the arteries for kidney are clogged, so people get kidney disease in which dialysis is required. For the brain, it leads to paralysis. For any arm, suppose if the leg arteries are clogged, so the people will develop gangrene of the leg. So because every artery is supplying to a vital organ, so if that organ is not getting blood supply, that organ will stop functioning. It is as simple as that. So, and second question was how to unclog. So there is a guideline or protocol that if the patient presents to us within 6 hours of clogged arteries, we can give them medicines which can open those arteries. And if patients are coming after that, so for every organ there is different protocol. For heart, say it is stenting or bypass. For brain it is different. For kidneys it is different. So for every organ there is a different protocol for how to unclog the artery and what is their timing. But general practice is less than 6 hours.
Heart specifically.
Oh, he has mentioned heart specifically. Okay. So for the heart, we have already discussed that the chest pain, breathlessness, heaviness, these are the symptoms for the clogged arteries of the heart. And to unclog them, if there is just a thrombus, we can give them medicines like streptokinase within 6 hours. They can open up. If it is not a soft clot or not a thrombus, there is hard plaque, which is because of the fat deposition. Then either we have to do stenting, or if the blockage is at multiple places, then we have to do a bypass surgery.
Okay, thank you, sir.
Thank you.
I hope your question has been answered. Do we have any other question?
Maureen, we should wind up, I suppose, 3 minutes, and I think Dr. Bansal is quite busy.
Yes, ma'am. Okay. Well, I, with a heavy heart, have to let you all know that this session cannot be taken forward any minute now. We all need to respect and be considerate about Dr. Bansal's time as well. Thank you so much for the information, knowledge, and wisdom that you shared with us, Dr. Bansal. We can't thank you enough for gracing our event on World Heart Day. You truly are a definition of a wonderful doctor. Thanks a zillion, sir. I would now like to invite Mrs. Deepika Barri for the deliverance of vote of thanks. Over to you, ma'am.
Thank you so much, Dr. Bansal. बहुत वाकई ही बहुत overloaded knowledge. But then जैसे Mehreen कह रही है that with a heavy heart we have to let you go. You know, we have so many questions, but your patients are waiting, and we won't take more than this, whatever we assured. And I would like to thank Dr. Richa Ranjan, who is here with us, and Seema ji, Sunaina ji, who are presidents for Wiki's various chapters, and all other esteemed members present who took out their time for this webinar. So thanks a lot, and special thanks to Mehreen for making it so interesting.
My pleasure, ma'am. Thank you so much.